Welcome to the deep dive. We've got quite a bit of source material here on a really important topic in veterinary medicine. We've been digging into it for you.
That's right. And our goal today is to sort of unpack all this and really explore ventricular tachycardia VT in animals. We want to pull out the key stuff for you, what it actually is, why it's, such a big deal, which animals tend to get it, how it's diagnosed, and crucially, what the treatment looks like.
Yeah, it sounds like something you definitely need to understand if you're facing it. So, okay, jumping right in, based on these sources, how do we actually define ventricular tachycardia? What is it?
Well, fundamentally, the definition from the ECG, the electrocardiogram, is pretty specific. It's three or more ventricular premature contractions. VPCs, you sometimes hear them called basically premature beats coming from the ventricles happening right in a row.
Okay, so not just a blip, but a run of these abnormal beats from the lower heart chambers. And the sources, they really stress this is potentially life-threatening.
Well, absolutely. And, what's interesting is how it pops up. Sometimes it's in hearts that otherwise look okay, maybe some kind of hereditary electrical thing going on. But more often, it's a signpost, really. It points towards underlying trouble with the heart muscle itself, like, cardiomyopathy, which is disease of the muscle, or maybe severe valve problems, or even inflammation, myocarditis.
Right, so the heart's already struggling, and the VT is kind of a symptom of that deeper issue. And speaking of how serious it is, there was a really stark point in the sources about treatment, wasn't there? Something quite sobering.
There was, yeah, and it's something we have to get out there right away. The sources are very clear. Currently, there isn't any known medical therapy that can reliably prevent sudden death in animals that have these ventricular tachyarrhythmias. We have drugs to manage the rhythm, sure, but stopping that worst outcome entirely, that's still a huge challenge.
Wow. That really hits home how serious this is. So, okay, given that major limitation, how do we even spot this rhythm? What does it actually look like on an ECG trace?
So on the ECG, VT has some pretty clear giveaways. The heart rate itself is usually fast, typically up over 150 beats per minute. The rhythm might be regular, might be a bit irregular, but the real visual signature is the QRS complex.
That's the main spike on the ECG.
Exactly, yeah. It shows the electrical signal spreading through the ventricles just before they squeeze. Now, in VT, these QRS complexes are normally wide, much wider than usual, and they often look, well, kind of bizarre, misshapen compared to a nice,
Yeah.
neat, narrow QRS.
Wide and bizarre QRS complexes. That's the main clue
It's
there.
a huge one, yeah. Another thing, if you can even spot them, is how they relate to the P waves. P waves show what the atria, the top chambers, are doing electrically. Normally, you get a P wave and a QRS, P wave, QRS, with consistent timing.
Right.
But in VT, the P waves, if you can see them because the rate's often so fast they get buried, they're usually completely dissociated from the QRS complexes. It's like the atria are doing their own thing, and the ventricles are just firing off rapidly, totally independently.
Dissociated, like electrical chaos, basically. And I thought it was really interesting how the sources talked about breed-specific ECG patterns. What's that about?
It is fascinating, isn't it, how it can look different depending on the dog. So in boxers, for example, the VT often shows up as positive spikes in certain leads on the ECG, or it might have this pattern we call a left bundle branch block look. Whereas, Dobermans and German Shepherds, they often have VT that can be polymorphic, meaning the QRS shape changes from beat to beat, or monomorphic, where it's more consistent. These little clues can sometimes hint at the underlying problem.
Okay, so we know what it is, what it looks like, but why is this rhythm, the one starting in the ventricles, so much more dangerous than, say, a fast rhythm from the upper chambers?
Well, the immediate critical danger is its potential to just spiral.
Yeah.
The main risk with VT is that it can suddenly degenerate into ventricular fibrillation VFib.
VFib, that's like total chaos.
Pretty much. The heart muscle just quivers uncontrollably, totally uncoordinated. It's not pumping blood effectively at all. And when that happens, blood flow stops, and that leads directly, almost instantly, to sudden death.
Okay, so VT is like one step away from VFib and sudden death. That's the big fear.
That's the immediate life-threatening fear, yes. And like we said, VT usually means something else is wrong underneath. Often significant heart muscle disease, or maybe some serious metabolic issues, or electrolyte problems like low potassium or magnesium. These can make the heart muscle cells really irritable and prone to firing off abnormally. The sources mention a few mechanisms, things like increased automaticity, where cells just fire on their own, or reentry circuits, where the electrical signal gets stuck in a loop, or this thing called triggered activity.
And obviously the heart's the main issue, but it impacts the whole body, right? Because of
Yeah.
the poor pumping.
Absolutely. When the heart's beating that fast and often inefficiently during DT, it just can't push enough blood out with each beat. So you get poor perfusion, less oxygen and nutrients getting it everywhere else. That's why you see secondary effects like weakness or collapsing or just poor tolerance for exercise.
So who are we typically seeing this in? Is it more common in certain animals?
Well, the sources say it's actually pretty common in dogs. Less common in cats, but it definitely happens. Doesn't seem tied to any specific place geographically. It affects both dogs and cats. But yeah, there are definitely some breeds, especially dogs, that are much more prone to it.
And which breeds are on that high-risk list?
It's off of the large breed dogs that are known for heart muscle diseases, the cardiomyopathies. So boxers and Doberman pinschers are mentioned frequently. German shepherds too, often in the context of sudden cardiac death. And in cats, if we're looking at genetic heart lengths, Maine Coons and Ragdolls pop up in the discussion.
Okay, and do these breed issues tend to appear at certain ages? Is there a pattern?
Yes, and this is actually quite important because the patterns differ. I mean, if it's not a specific breed thing, VT could technically happen at any age. But for those predisposed breeds, boxers with that specific condition, ARVC, arrhythmogenic, right, ventricular cardiomyopathy, they often start showing signs or get diagnosed around 4 to 6 years old. And typically, their arrhythmias get more frequent and severe as they get older.
And Dobermans. Similar progression.
Dobermans with what's called occult cardiomyopathy, meaning it's there but maybe unobvious clinically, yet they tend to develop arrhythmias starting a bit earlier, maybe 3 to 6 years, sometimes later.
Yeah.
But yeah, like the boxers, generally the arrhythmias worsen over time.
What about the German Shepherds? You mentioned them too. Is their pattern the same?
No. And this is a really key difference highlighted in the sources. German Shepherds with these hereditary arrhythmias, they often start much younger, usually between 12 and 16 weeks old.
Weeks. Wow.
Yeah, weeks. And the arrhythmias increase in frequency and severity for a while, up until about 24 to 30 weeks. But, and this is the fascinating part, after they hit about 8 months of age, the severity tends to stabilize or even decrease.
Decrease. So unlike the boxers and Dobermans where it gets worse, in GSDs it might actually get better after a certain point.
Exactly. It's a totally different trajectory and really important for managing expectations if you have a young German Shepherd diagnosed with this. That potential for improvement is significant.
That really is a major difference. Okay, you mentioned hereditary causes. How strong is that genetic link?
Oh, it's very strong for several forms, especially when tied to those cardiomyopathies. In boxers, that ARVC condition is inherited as an autosomal dominant trait. The sources actually link it to a specific gene mutation, striatin, which is also involved in a similar condition in humans. They also mention something called the WNT signaling pathway.
And for Dobermans?
Their type of dilated cardiomyopathy, DCM, with VT, is also autosomal dominant, linked to a mutation in a different gene, PDK4. It's interesting the sources note that in people, DCM can be caused by over 20 different mutations, but in Dobermans, it seems linked to this specific one more consistently.
What about the German Shepherds and the cats?
For German Shepherds, the inheritance is described as hereditary, but likely polygenic, meaning it's probably one major gene influenced by several other modifier genes. It's more complex. And in Maine Coon and Ragdoll cats, there's a known mutation in a gene called MYBPC3 that causes hypertrophic cardiomyopathy, HTM, which then predisposes them to arrhythmias. The sources do point out it's a slightly different spot on that gene mutated in Ragdolls compared to Maine Coons.
So with these known genetic links, can you actually test for them?
Yes, absolutely. Genetic testing is available for some of these specific mutations in breeds like boxers, Dobermans, Maine Coons, and Ragdolls. But, and this is a really crucial practical point, the sources emphasize just testing positive for the gene defect doesn't guarantee that animal will actually get sick or show signs of the disease.
Ah, okay, so it's about risk, not destiny.
Exactly. It identifies predisposition, but other things, other genes, still play a role. It's not a 100% prediction.
That's incredibly important context for owners. Okay, so if an animal does have VT, what might the owner actually notice? Or what would a vet see? How do you recognize it?
Well, the tricky part is sometimes you see nothing at all. Some animals are completely asymptomatic. But if there are signs, owners might report things like syncope, which is fainting or collapsing spells or just general weakness. Maybe they can't exercise like they used to. And sadly, as we mentioned, sudden death itself is listed as a potential sign, meaning sometimes the first clue is the tragic event itself.
That must be devastating. And what about during a vet check? What might they find?
Well, again, the physical exam can be totally normal, especially if the VT isn't happening right at that moment because it's intermittent. If it is happening, the vet might feel a very, very fast heart rate. The pulses, like the femoral pulse in the leg, might feel weak, or they might sort of vary in strength from beat to beat during a run of VT. And depending on why the animal has VT, the vet might also pick up signs of congestive heart failure, like fluid in the lungs, or hear a heart murmur.
Okay, so if a vet hears that super fast rhythm, how do they nail down that it's definitely VT and not something else that just looks similar?
Yeah, that's the big diagnostic puzzle sometimes. The main challenge is telling VT, apart from another fast rhythm called supraventricular tachycardia, that's VT, where the problem starts above the ventricles, but there's also a block in the electrical wiring, lower down a bundle branch block. That block can make the QRS look wide on the ECG, mimicking VT.
Ah, right. So a wide QRS isn't automatically VT. How do you tell the difference then?
It often comes back to those P waves again. If you can clearly see P waves on the ECG, and each one is consistently followed by a wide QRS complex with a normal timing between them, that points more towards SVT with a bundle branch block. But if those P waves are totally out of sync with the wide QRS beats, or if the rate is just so fast you can't find any P waves at all, then VT is much more likely.
And the sources mentioned using drugs to help diagnose too.
Yeah, sometimes a therapeutic trial can help. For instance, giving a test dose of lidocaine might slow down or even stop VT, which helps confirm it. Or if it just slows it enough, maybe you can then see those dissociated P waves more clearly. On the flip side, if you suspect SVT, you might try a drug like Esmol. If that slows the rate and reveals P waves that are consistently linked to the QRS, then you lean towards SVT.
Sounds like some clever electrical detective work. What other tests are usually run?
Lab work is pretty essential. A basic blood count, biochemistry profile, and urinalysis. You absolutely need to check electrolytes. Potassium and magnesium levels are critical. Being too low or too high can trigger VT or really affect how well the treatment drugs work. They might also look for clues to other problems like pancreas inflammation markers, amylase, or signs of infection or inflammation like a high white blood cell count suggesting myocarditis.
Any specific heart-related blood tests?
Yes, cardiac troponin I, or CTNI. It's a marker for heart muscle injury, so it can be elevated if there's myocarditis. In cats, checking thyroid levels, T4, is important because hyperthyroidism is a known cause of arrhythmias. And depending on the history and location, testing for tick-borne diseases like Lyme might be done if myocarditis is on the list. And of course, the genetic testing we talked about if you suspect an inherited cardiomyopathy.
What about looking at the heart itself? Imaging.
Echocardiography, an ultrasound of the heart, is usually vital. It lets the vet actually see the heart structure and how well it's pumping. You can spot things like thickened or stretched out heart muscle from cardiomyopathy, check the valves, or see signs suggesting inflammation. It helps find that underlying cause for the VT.
And we talked about VT being intermittent. So is just one quick ECG in the clinic always enough to catch it?
No, and the sources are really emphatic about this. While a standard ECG is where you start, if you suspect VT is happening only sometimes, especially in an animal that's fainting or weak for no obvious reason, then long-term ambulatory monitoring is key.
You mean like a Holter monitor?
Exactly. Sending the animal home wearing a small device that records their ECG continuously for 24 hours, or sometimes longer, with an event recorder. A short, snapshot ECG in the clinic can easily miss sporadic bursts of VT that are the real problem. The Holter gives you the bigger picture.
That makes total sense. You need to catch it in the act, basically. Okay, so once you've got the diagnosis, maybe you're figuring out the underlying cause. How do you actually treat or manage the VT itself?
Well, the approach really hinges on how stable the animal is. If you've got a patient who's pretty stable, maybe just having intermittent runs of VT found on a Holter, the ideal thing is to do the full workup first echo labs and get that baseline 24-hour Holter before you start any antiarrhythmic drugs. That way you know exactly what you're dealing with before you intervene.
Right, get a starting point. But what if the animal is really sick, unstable?
If the animal's unstable, collapsed, very weak, fainting frequently, then that's an emergency. They need immediate treatment with intravenous drugs in a hospital, hooked up to a continuous ECG monitor. Once they're stabilized on the IV meds, then you can transition them to oral medications to go home on. And after starting oral meds, a follow-up 24-hour Holter is crucial.
Why the follow-up Holter specifically?
Two big reasons. One, to see if the drug is actually working. Is it suppressing the VT effectively? And two, very importantly, to check for what are called pro-arrhythmic effects. Sometimes, paradoxically, the drug you give to fix one arrhythmia can actually cause a different, potentially worse arrhythmia. You have to watch out for that.
That's a scary side effect. What about things like exercise? Should these animals be kept quiet?
Generally, the sources say there's not really strong evidence that strict exercise restriction helps in most VT cases. There is one exception noted, though: boxer dogs. Apparently, excitement or stress can trigger more VT in some boxers, so owners might need to identify and try to avoid those specific high-stress situations for their dog.
And I remember reading that client education is vital.
Oh, absolutely essential. Owners have to understand the risk of sudden death that comes with this condition, even if the animal is on medication and seems okay. It's a tough conversation, but it's necessary so they have realistic expectations.
What if an animal with VT needs anesthesia for, say, a dental cleaning or something unrelated? Any special precautions?
Yes, the sources give pretty clear advice. Ideally, figure out and treat the cause of the VT before the anesthesia, if possible. Doing a quick lidocaine trial beforehand can be useful to see if the VT is responsive. During the procedure itself, continuous ECG monitoring is mandatory, and you want to avoid certain anesthetic drugs known to potentially worsen arrhythmias, specifically alpha-2 agonists like xylazine or medetomidine, and also thiopental. Interestingly, using acepromazine as a pre-med might actually be beneficial, as it can apparently raise the threshold for VFib.
Okay, let's talk medications then. What are the main drugs used? Is it different for an emergency versus long-term control?
Yes, definitely different strategies. But first, and this is critical, always check and correct low potassium or low magnesium levels if they're present. Those imbalances can really mess with how the antiarrhythmic drugs work, or even cause the VT themselves.
Right, fix the electrolytes first. Then what? For an acute emergency in a dog?
For acute life-threatening VT in dogs, the go-to drug is usually lidocaine. It's given as an IV bolus, a quick push, followed by a continuous rate infusion, a CRI, meaning a steady drip. The sources give doses, like starting with boluses of maybe 2 milligrams per kilogram up to a total of 8 milligram kilograms, and then a CRI around 30 to 80 micrograms per kilogram per minute.
And if the lidocaine doesn't work?
If lidocaine fails, the next step is usually procainamide. That can also be given IV as boluses or in infusion, or even intramuscularly sometimes. Doses mentioned are like IV boluses of 2 milligram kilogram up to 20 total, then an infusion of 20-50 mics per kilo per minute. For really tough cases, the sources say you can even combine lidocaine and procainamide CRIs.
Okay, and if that doesn't work?
If you're still not getting control, esmolol, which is a very short-acting IV beta blocker, can be tried. But there's a warning. Combining esmolol with procainamide carries a risk of causing really low cardiac output and dangerously low blood pressure, so you have to be cautious there.
Got it. So that's the emergency plan. What about sending a stable dog home on pills for chronic VT?
For chronic management in a stable dog, Sodalo is a common oral choice. It's usually given twice a day, maybe 1 to 2 milligrams per kilogram each time. Another drug, mexiletine, isn't usually super effective on its own. Often, especially for difficult cases or in breeds like boxers, you need combination therapy. A common combo is mexiletine, usually given every 8 hours, plus a beta blocker like atenolol or sotalol.
You mentioned German Shepherds needing a special approach earlier.
Yes, absolutely. This is a key breed-specific point from the sources. For German Shepherds, with those hereditary arrhythmias, the combination of mexiletine and sotalol seems to be the most effective approach. And critically, sotalol by itself monotherapy should generally be avoided in German Shepherds. There's a higher risk it could actually make arrhythmias worse, the proarrhythmic effect, in that specific breed.
That's vital to know. What about cats? Are the drugs different for them?
Yes, cats are different. They metabolize things differently and are much more sensitive to some side effects. You can use lidocaine for sustained VT in cats, but you have to be extremely careful because neurotoxicity seizures is a real risk and happens more easily. The sources say use about 1/10 a dog dose, very cautiously. For long-term oral management in cats, atenolol, a beta blocker, is often preferred, usually given twice a day. And the sources also list things to actively avoid until the VT is under control, drugs like atropine or stimulants like epinephrine or dopamine, because they can just fuel the fire. And you need to be cautious with beta blockers if the animal also has congestive heart failure. You usually need an echo to monitor that.
What if none of these standard drugs work? Are there last resort options for really refractory cases?
For those really tough, life-threatening VT cases in dogs that just aren't responding, amiodarone is mentioned as an option. It's a powerful drug, but it comes with a significant downside potential. The sources really stress weighing the benefits against the risk of side effects, which can include liver toxicity, GI upset, blood count changes. If you use amiodarone, you absolutely have to monitor liver enzymes regularly. For cats with really stubborn arrhythmias, sotalol might be considered, again, dosed carefully.
Okay, so lots of drug options, lots of nuances, very tailored approaches. How do you actually know if the treatment is working well enough?
This brings us back to monitoring, and specifically the Holter. The sources are crystal clear. Holter monitoring is the best way to assess both how bad the arrhythmia is to start with and how well the chosen therapy is working. The target, according to the sources, is a pretty significant reduction. You want to decrease the amount of ventricular ectopi, meaning the abnormal beats and runs of VT, by over 85%.
Over 85%. That's a high bar. Why aren't things like just doing occasional ECGs or watching them on telemetry in the hospital good enough for monitoring success?
Well, because the VT can be so on and off, so sporadic, you might catch them on a good day with a short ECG or during a quiet period on telemetry and think everything's great, but you could be missing frequent, dangerous runs happening at other times. That 24-hour Holter gives you a much more complete view of what's really going on throughout a normal day and night cycle. Oh, and also, if the animal happens to be on digoxin for heart failure, you need to monitor those blood levels too, because it has a narrow safety margin.
Makes sense. And lastly, is there anything owners can do for prevention or things to avoid?
Prevention mostly comes down to managing those underlying factors if they exist, correcting electrolyte imbalances like low potassium or magnesium, ensuring good oxygen levels if there's respiratory disease, avoiding toxicity from other drugs like digoxin, and then that specific point for boxers. Trying to minimize really stressful or highly exciting situations might help reduce how often their VT occurs.
Okay, so pulling this all together, what's the bottom line? What's the typical outlook, the prognosis for an animal diagnosed with VT?
It really varies. It depends almost entirely on why they have the VT. If it's caused by something reversible, like an electrolyte problem that you fix, or maybe temporary inflammation that resolves, the prognosis can actually be quite good. The VT might even go away completely once you treat the underlying cause.
But what if it's linked to serious chronic heart disease?
Then the prognosis is usually more guarded. If the VT is happening because of something like advanced cardiomyopathy, well, those diseases themselves are often progressive. They get worse over time. The arrhythmias often worsen too, and having significant VT dramatically increases the risk of sudden death, unfortunately, even with the best treatment we have.
And the sources mentioned a connection to cancer as well.
Yes, sadly. If the VT is found alongside certain aggressive cancers, particularly hemangiosarcoma of the heart or spleen, the long-term outlook is generally grave. The prognosis in that case is really dictated by the underlying cancer, which is often very difficult to treat successfully.
Were there any specific prognosis details for those breeds we kept mentioning?
Yes, the sources gave some sobering statistics. For German Shepherds with those hereditary arrhythmias, about half of them, 50%, who have more than 10 runs of VT in a 24-hour period, end up dying suddenly. However, remembering that unique age pattern, the risk of sudden death goes down quite a bit if they manage to reach 18 months of age.
Okay, so there's hope if they get past that initial risky period. What about Dobermans?
Dobermans with VT and occult DCM present a different, often scarier picture compared to boxers sometimes. The sources specifically note that Dobermans may actually die suddenly during their very first fainting episode.
Huh.
It just highlights how unpredictable and potentially catastrophic it can be in that breed, even before you might realize the full extent of the heart disease. It really underscores that VT isn't just one thing. Its impact and the animal's future depends so much on the whole picture, the breed, the age, and especially the underlying cause.
It certainly does. Okay, so wrapping up our deep dive into ventricular tachycardia in animals today, we've seen it's a really serious electrical problem in the heart. It's often a red flag for underlying heart disease or maybe a genetic issue. The ECG signs are pretty distinct, but actually diagnosing it, especially if it's intermittent, often needs those specialized tools like Holter monitors.
Right, and the treatment is complex, isn't it? Lots of different drugs, combinations needing careful monitoring for effectiveness, and those potential pro-arrhythmic side effects, often tailored to the specific animal and breed.
And despite all that, the sources remind us that fully preventing sudden death is still, well, a major hurdle. We've tried to pull out the most critical pieces from the material for you. The definition, the dangers, who gets it, how we find it, the treatment maze, and the variable outlook.
Exactly. Covered a lot of ground there.
So here's a final thought for you to consider, based on everything we've discussed from these sources. We heard that the goal of drug therapy is this big reduction in abnormal beats, right? Over 85% suppression. But at the same time, the sources state flat out there's no known medical treatment to completely prevent sudden death. So, what does that apparent contradiction really tell us about the core challenge here? Is the ultimate risk of sudden death mainly driven by the relentless progression of the underlying heart damage itself, which the drugs don't fix? Or is it purely down to the arrhythmia, those dangerous electrical events that we're maybe only partially controlling, even with our best efforts? Something to think about.